A Travis County man infected with monkeypox sharing his experience fighting the virus,
including the struggles he's faced trying to get a diagnosis and medication. KVUE's Connor Board shares his story.
Talking through Zoom is something we got used to with COVID.
You're quarantining right now, is that correct?
Yep, I'm quarantining, isolating.
But now we're using it with monkeypox.
By far the worst pain in my entire life.
This Travis County resident who did not want to be named first had a fever. He thought it was side effects from the monkeypox vaccine he received just days before.
You know, you think you're taking the correct steps. Of course, there's always something. You could always be more careful, right? But here we are.
But the symptoms progressed with lesions and extreme pain. He had a feeling it was monkeypox, so he went to the ER, where he says the doctor told him they'd never done a monkeypox test.
She said, oh, I really don't think it's monkeypox as she's swabbing me. If it was, I'd have to be in like full PPE, which she was not. So I was like, okay, this is frustrating, but like they're testing me.
He also told doctors he had a potential exposure. They said the test results would take 5 days. 8 days later, he still hasn't gotten them.
But I was on Reddit, I was on TikTok, reading people's firsthand accounts.
He went to the ER 2 more times, saying the symptoms were unbearable. He was hoping to get tecovirimat, known as TPOXX, an antiviral medication used to treat certain cases of monkeypox.
I was sick, right? I was in a ton of pain. And ideally, you expect, especially going to the ER, you expect them to have at least some knowledge of like what they can do to help you. And I felt like they just didn't know what they could do to help me.
After 4 days taking pain medications that were not working and finding out his potential exposure tested positive for monkeypox, he got a telehealth visit with an infectious disease doctor who prescribed him TPOXX.
And that was probably such a relief that it was so easy within 1 day of an appointment to get the medication.
As soon as he said that like he'd be able to get it to me that afternoon, I lost it.
He hopes the healthcare system will learn to better care for patients and encourages patients to advocate for themselves.
Don't be afraid to be resourceful and find information and try to advocate for yourself when you can.
Now, under CDC guidelines, TPOXX, the medicine used to treat monkeypox, can only be given to patients with certain severe symptoms or those at risk of severe disease.
Some public health officials say they follow CDC guidance, and right now they have enough TPOXX medication to meet demand.